With me now is Fox News medical correspondent Dr. Marc Siegel. Doctor, there's lots of concerns about the health crisis. It's a humanitarian issue, what's happening in Tijuana, right?
I feel very badly for the people there. The migrants are in trouble because they're in such close quarters. Hygiene might not be what you would want, and the respiratory viruses. The issue is that the viruses spread very quickly among people that are in close quarters, especially this time of year. So the report was that from Griff Jenkins this morning, 1/3 are sick. It's probably more than that. I think that that's probably underreported. The nurses have been telling him that. Respiratory viruses, I'm concerned about something like chickenpox, which is going around down there, because a lot of people aren't vaccinated. That's about a 90% infectivity rate, chickenpox. And you can get quite ill. We think of that as a childhood disease. You can get quite ill from that. 3 cases of tuberculosis down there. That's very problematic. Hepatitis A and lice. And also, of course, other diseases like heart disease, asthma. So there's a lot of problems with the conditions. It's only going to get worse.
Yeah, and the Tijuana mayor says $30,000 a day funding for the migrants is running out. We're going to stay on that story for you. Let's switch to another shocker of a story. Life expectancy dropping in the U.S. for the 3rd straight year. Let's talk to the doctor about this, because rural America is really getting hit, too. This is stunning. We haven't seen it dropping at this rate since World War I.
You know, when I saw this, my jaw dropped because I thought it was going to be the obesity epidemic that you and I talked about last week, that people are overweight, that they get heart disease, that they get cancer, that they get strokes. That's stable. In fact, we have less cancer, people dying of cancer than before. It's actually suicide and the drug overdoses we've been talking about. We're seeing 70,000 drug overdose deaths per year, which is up because of illegal fentanyl. Even as we start, Liz, to get a handle on doctors not prescribing too much, on pharmacies not giving out too much, we still got illegal chemists in China and Mexico with their fentanyl that's caused over 30,000 overdose deaths in places like West Virginia, Ohio, the capital, Pennsylvania. So those states, New Hampshire, are getting really hammered with overdose deaths. Then we have suicide in places that are my favorite places in the country. Nevada, Wyoming, Montana, Idaho, New Mexico, gorgeous places where you would think just being alive in this place would be enough to sustain you, but not if you don't have a job. 2017, this is the statistics we're talking about, 53,000 deaths, 53% increase over 1999, 53% increase, and it's because of job loss. Now, I'm hopeful with the economy recovering that we're going to see improvement this year.
Yeah, because this is despair and lack of hope. So the White House has been battling to get jobs for, across the country. Is that the curative here?
I think that's the cure.
One of the cures,
This
right?
has been hitting mainly ages 25 to 44. I think that the White House getting us on track in terms of the economy, I think we're seeing more jobs than ever before. That's going to translate into people being happier in rural states like the ones I just mentioned.
It's a health crisis. Doctors are trying to help with the opioid addiction. It's a humanitarian crisis. And, Doc, we love having you on. You're going to stay on the story for us?
Absolutely.
It was a shocker when we saw that.
Unbelievable.
Right?
I never expected that. And
yeah.
hopefully, I think jobs will translate to people being happier and
we hope so.
Staying alive.
Thinking of those folks out there. Thank you, Dr. Siegel.